5 things to know about dialysis for kidney patient. Welcome to today's video, where we're diving deep into the world of dialysis, a life-saving treatment that plays a crucial role for millions of people living with kidney failure. If you or someone you know is undergoing dialysis, or if you're simply curious about this process, this video is for you. In the next few minutes, we're going to explore 5 key things you need to know about dialysis. We'll cover everything from what dialysis actually is and how it works, to the 2 main types of dialysis, the frequency of treatments, the important diet and fluid restrictions, and why dialysis requires ongoing care throughout a patient's journey. First, we'll talk about the most fundamental point. Dialysis is a treatment, not a cure. While dialysis can help manage kidney failure, it doesn't restore kidney function. We'll also explore how dialysis, whether hemodialysis or peritoneal dialysis, works in very different ways, and how the frequency of treatment varies depending on the type of dialysis. You'll learn why diet and fluid restrictions are an essential part of the process for dialysis patients and how those changes affect daily life. Finally, we'll get into the importance of ongoing care. Dialysis isn't just a procedure, it's a lifelong commitment that requires constant monitoring and adjustments to keep patients healthy. If you've ever wondered how dialysis impacts the daily lives of those who rely on it, or what goes on behind the scenes to make it work, keep watching. This is everything you need to know to understand the complexities and realities of living with dialysis. Number 1. Dialysis is a treatment, not a cure. When someone is diagnosed with kidney failure, dialysis becomes a crucial lifeline. However, it's important to understand that dialysis is not a cure for kidney disease, it's a treatment designed to help manage the symptoms and complications associated with kidney failure. The kidneys are essential organs that filter waste, excess fluids, and toxins from the blood, while also regulating vital substances like electrolytes. When the kidneys no longer function properly, dialysis steps in to take over this critical role, helping to keep the body in balance. But unlike a kidney transplant or the natural healing of kidneys, dialysis doesn't restore kidney function. It only acts as a temporary replacement, ensuring that waste products and fluids do not build up to dangerous levels in the body. Patients undergoing dialysis must continue with the treatment for the rest of their lives or until they receive a kidney transplant. While dialysis can significantly improve the quality of life for patients with kidney failure, it comes with its own challenges. Dialysis treatments can be time-consuming, requiring frequent visits to a clinic or daily sessions for at-home care. The process is also not without risks, such as infections, blood clots, or other complications. Therefore, while dialysis is an essential treatment for maintaining life in the absence of kidney function, it is not a permanent solution. Patients still need to manage the underlying causes of kidney failure, like diabetes or hypertension, and they often look toward kidney transplants as the only real way to reverse their condition. The hope is always to stabilize health, buy time, and maintain quality of life until a better, more lasting option comes along. Number 2. There are 2 types of dialysis. When it comes to dialysis, it's essential to know that there are 2 main types, hemodialysis and peritoneal dialysis. Both serve the same purpose, filtering the blood to remove waste and excess fluids, but they do so in very different ways. Hemodialysis is the most common form, and it involves a machine that acts as an artificial kidney. During this procedure, the patient's blood is drawn out of their body through a needle inserted into a vein, then passed through a dialysis machine that filters out toxins and extra fluid. The clean blood is then returned to the body. Hemodialysis usually takes place at a clinic, with patients visiting 3 times a week, typically for 4 hours each session. It's a highly effective method of dialysis, but it requires regular trips to the clinic, can be physically exhausting, and is often associated with a strict schedule. On the other hand, peritoneal dialysis is an at-home treatment that uses the patient's own abdominal lining, known as the peritoneum, as a natural filter. In this method, a sterile solution is introduced into the abdomen through a catheter, and waste and excess fluids pass from the blood vessels in the peritoneum into the solution. After a set period, the solution, now containing waste, is drained out and replaced with fresh fluid. Peritoneal dialysis can be done manually during the day or through a machine at night, allowing patients greater flexibility and freedom compared to hemodialysis. One of the benefits of peritoneal dialysis is that it can be done at home, providing patients with a sense of independence. However, it does require careful attention to hygiene and is not without risks, such as infection of the peritoneum, peritonitis. Both methods have their pros and cons, and the choice between them depends on various factors, including the patient's health, lifestyle, and personal preferences. While hemodialysis may be the preferred option for those who need regular, intensive treatment, peritoneal dialysis offers the convenience of home care, making it a suitable choice for many patients who want more control over their routine. Ultimately, both types of dialysis are essential in helping people with kidney failure lead healthier lives. Number 3. Dialysis frequency varies. When it comes to dialysis, one key aspect that varies from patient to patient is the frequency of treatment. The frequency largely depends on the type of dialysis the patient is undergoing and the specifics of their medical condition. For instance, hemodialysis is typically performed 3 times a week, with each session lasting between 3 to 4 hours. This regular schedule is crucial because the machine performs the vital work of filtering the blood, and if done too infrequently, toxins and excess fluid can build up in the body, leading to complications like high blood pressure, swelling, or even life-threatening situations. Despite being a life-saving treatment, hemodialysis can be exhausting for patients, as each session demands a significant amount of time and energy. Patients often find themselves tethered to a strict routine, needing to adjust their daily life to accommodate these appointments. In contrast, peritoneal dialysis offers more flexibility. Many patients on peritoneal dialysis can do their treatment daily, but they have the option of tailoring the process to suit their lifestyle. Some patients opt for continuous ambulatory peritoneal dialysis (KTD), which involves manually exchanging dialysis fluid 4 or more times a day. Others use automated peritoneal dialysis (APD), where a machine performs the exchanges at night while they sleep. While peritoneal dialysis provides more autonomy and flexibility, it still requires a consistent routine and attention to hygiene to avoid infections or complications. The frequency of treatment can be tailored based on the patient's condition, but daily treatment is often necessary to keep the body's fluid balance and toxin levels under control. One of the significant challenges with dialysis is that the treatment doesn't provide an instant solution to kidney failure. It helps manage the symptoms, but it doesn't restore kidney function. This means that even though dialysis is crucial for survival, patients often face the reality of needing ongoing treatments for the long term. For many, this treatment routine becomes a way of life, requiring careful time management and lifestyle adjustments. The variation in frequency across different types of dialysis means that every patient's treatment plan is personalized, taking into account their unique health needs, preferences, and overall quality of life. It's this combination of treatment frequency and lifestyle adaptation that helps patients with kidney failure maintain their well-being as they manage the challenges of living with this chronic condition. Number 4. Diet and fluid restrictions are common. When someone begins dialysis treatment, one of the most significant lifestyle changes they must adapt to is a strict regimen of diet and fluid restrictions. Since the kidneys no longer perform their natural filtering role in the body, dialysis helps to remove waste and excess fluids, but it can't do everything the kidneys used to. As a result, patients undergoing dialysis often face limitations on the types and amounts of food and drinks they can consume. These dietary changes are essential to prevent dangerous imbalances in the body's electrolytes and fluids. For example, many dialysis patients must limit their intake of foods high in potassium, like bananas, potatoes, and tomatoes. Excess potassium can build up in the blood, leading to life-threatening heart arrhythmias. Similarly, phosphorus, which is found in foods like dairy products, nuts, and certain meats, must also be restricted. High phosphorus levels can lead to bone disease and other complications, as the body struggles to maintain a healthy balance. Dialysis patients may also need to reduce their sodium intake to prevent fluid retention and high blood pressure, which can further complicate their health. Fluid intake is another critical area where restrictions are common. The kidney's inability to remove excess fluid means that dialysis patients often need to limit how much they drink. If too much fluid accumulates in the body, it can lead to swelling, high blood pressure, or fluid buildup in the lungs, making breathing difficult. Fluid restrictions can vary depending on the individual's condition, but many patients are advised to monitor their liquid intake carefully throughout the day, which can be a challenging adjustment for those who are used to drinking freely. The impact of these dietary and fluid restrictions on daily life can be profound. Patients often need to work closely with dietitians to develop meal plans that ensure they get the necessary nutrients while avoiding harmful foods and drinks. This requires careful monitoring and discipline, as even small lapses can lead to severe health consequences. In addition to adhering to dietary guidelines, dialysis patients must stay informed about their condition, keeping track of their lab results and adjusting their diet as needed. The goal is to find a balance that helps maintain health, energy, and well-being while managing the restrictions that come with dialysis. For many patients, this process becomes a part of their daily routine and a necessary step in managing the complexities of living with kidney failure. Number 5. Dialysis requires ongoing care. Dialysis, while a life-saving treatment, is not a one-time fix. It requires ongoing care, both medically and personally, to ensure that patients maintain their health and quality of life. Unlike treatments for other conditions that might have a set duration, dialysis is a long-term commitment that patients need to integrate into their daily lives. For those with chronic kidney disease, dialysis becomes a routine part of their existence, and it's essential to monitor various factors, from physical well-being to mental health, in order to avoid complications and improve the effectiveness of the treatment. Regular checkups and lab tests are critical to assessing how well the dialysis is working and whether adjustments are necessary. Blood tests are commonly used to track levels of key electrolytes, such as potassium, sodium, calcium, and phosphate, to ensure they stay within safe ranges. Dialysis patients often have to deal with fluctuating lab results, and their treatment plans may need to be fine-tuned as their condition evolves. Additionally, medical staff will continually monitor for potential complications like infections, which are common due to the invasive nature of dialysis procedures, especially for those on peritoneal dialysis. Dialysis patients also need to stay on top of their medication regimen, including phosphate binders, blood pressure medications, and sometimes erythropoiesis-stimulating agents to help with anemia. These medications help manage side effects, control symptoms, and support the patient's overall health. It's a delicate balancing act, taking the right amount of medication at the right time, adjusting dosages, and making lifestyle changes as needed. On a more personal level, dialysis can be physically and emotionally draining, and it's vital for patients to seek ongoing support. The treatment process can be exhausting, especially for those undergoing hemodialysis multiple times a week, and the emotional toll of living with kidney disease is significant. Many dialysis patients experience feelings of isolation, frustration, or anxiety, knowing they must undergo this life-sustaining treatment indefinitely. Support from healthcare providers, family, friends, and support groups is often critical to help patients cope with the psychological burden of their condition. Furthermore, patients on dialysis often have to make adjustments to their daily routines, work schedules, and social lives to accommodate treatment. It's not uncommon for individuals to take time off from work or school for dialysis sessions or to plan their social activities around the need for rest after treatments. The treatment's impact on daily life is one of the most significant challenges, and it requires ongoing care and planning to ensure that patients can maintain some semblance of normalcy. In summary, dialysis is not just a medical procedure, it's a long-term care plan that demands constant attention and adaptation. From monitoring health markers to adjusting lifestyle choices and maintaining emotional well-being, dialysis requires a holistic approach to care that goes beyond the treatment chair. For many, the path of dialysis is a marathon, not a sprint, and ongoing medical support is key to navigating this journey with resilience and hope. Summary. Thank you so much for watching today's video. I hope you found it informative and insightful. Dialysis is such a vital treatment for those with kidney failure, and understanding how it works and how it affects people's lives is so important. If you or someone you know is going through dialysis, I hope this video provided a little more clarity on what the journey looks like and what's involved in managing this condition day by day. Remember, dialysis is just one part of a much bigger picture. It's a treatment that requires patience, care, and constant monitoring. It's not an easy path to walk, but it's one that countless people manage with strength and determination. If you've learned something new today, don't forget to give this video a thumbs up. It helps us reach more people who might benefit from this information. If you have any questions or if there's something you'd like to know more about, feel free to leave a comment down below. We love hearing from you, and we're here to help provide more answers and resources. Also, if you haven't already, make sure to subscribe to our channel and turn on the notification bell so you never miss out on any future videos. We're committed to providing more content that can help you better understand important health topics and improve your well-being. As always, take care of yourselves and your loved ones. Whether it's managing chronic conditions or just staying healthy, remember you're not alone in this. Thanks again for watching, and we'll see you in the next video. Stay healthy and take care.